Luckily with eyelid surgery, there's very little that can go wrong. I say impact is high and effectiveness is high and risks are very low. We don't take risks lightly, but they still are very low. Things like infection, extremely uncommon around the eyelids. Bruising and swelling, those are actually extremely common. Something that could harm your eye or your vision, uncommon, but we're very anal on blood thinners because of that reason. Lastly, pain. Am I going to be uncomfortable, somebody might ask. Truly, the incisions that we make really do not have much discomfort. When and if I need to work on that brow and help support that, I say that that's usually the first place that people are going to notice some discomfort, and that can take sometimes up to 6 to 8 weeks to slowly get better and finally dissipate. It will. If we're specifically doing a ptosis repair on a patient, it means we're going to lift the eyelid. Remember, the shade's going to come up a little bit. I tell patients that in the Goldilocks world, everything ends up just right. And that's what I want for you, and that's what I want for all of my patients. With that particular step, however, when we're going to lift the shades, we want this. We don't want too much lift, but we also want to be like, hey, Dr. Tendler, did you lift me up a little bit? So we want some lift and not too much lift. We also want symmetry. We want to have nice symmetry from one side to the other. In the world of ptosis, a good result is an improvement in eyelid height and symmetry within about 1 millimeter of the other eye. That's really not noticeable to the naked eye or someone in the public looking at you. If for some reason we end up a couple millimeters difference in height, that will be noticeable, and I might not be happy and you might either. If that happens, we are possibly looking at a need for a second surgery, which for the other aspects of eyelid surgery truly is not that common. But in ptosis, very special, there is that small risk. I put the chance of being successful and having a nice result with good lift and good symmetry at about 90 to 95%.